As you can see on diagram A, this is what's called a gastric bypass. The stomach has been divided in a small pouch at the top, and then the small intestine is brought up and sewed to the small pouch. So that most of the stomach is actually physically bypassed and the food never gets into it.
So you've created just a smaller container so that it can't hold as much.
Exactly.
Does that affect appetite? Is that how it's working?
That's the whole idea, is that the people are not hungry and it does not take much to fill them up.
Now, does that all stretch out?
Unfortunately, it does to some degree on everybody. If the people remain compliant to the procedure, don't snack or nibble continually, or don't eat large meals, it'll stay in a relatively small shape.
I'm really interested in seeing how these staple machines work. Could you show us, maybe with some of the demonstration material you brought?
The stapler that we use actually with the gastric surgery is this size of stapler, which carries 90 staples.
Let me just see this. This is, I guess, supposed to be the stomach.
Right.
And food comes down here. That's from the swallowing tube right into here.
Right.
And that's the stomach that's filling up, and then the food goes out through here into the rest of the intestines.
Mm-hmm.
And what happens? You take that staple and... Now, this is actually the machine that would be used in the operating room.
Right. Of course, it'd have to be autoclaved and made sterilized.
Right.
But, yes. And then first firing approximates it.
So that first thing...
Second firing, if you can squeeze it, fires the staples.
So when you say approximates it, what does that mean? It
moves the teeth up to squeezing on the stomach.
Squeezes it together. Ouch. Look at that. It's full of staples. These are real staples.
They're stainless steel.
Now,
good,
what happens to those?
Good for a lifetime.
They don't rust or anything.
No.
Do they come out, or they just
no,
sit there?
They don't come. They're not supposed to come out. If the people over-distend the pouch and overeat, they can tear them out.
So what's happened now is that the food would come in here, the staples sort of block it so the food can't get through to the rest of the stomach. Now, how would the food get
out
through now? Yeah, what happens there?
Well, you would have to either bring up a limb of small intestine, like I showed with either a loop or the Roux-en-Y, to drain it. Let me show you with that model, something that's a little closer to the size. Let me get this together. Well, let's use a fresh stomach here. The stomach's been digested. This is more, actually, it comes across like this. The gastroplasty with the reinforced opening is actually fired across like this, and you'll notice there's a little remnant here. And at surgery, we have a mercury-contained rubber tube that is a certain size, in this case 10 to 12 millimeters, that comes down through the mouth, down the food pipe, into the stomach, and then down through there. So that when you move the stapler up against it, you are certain that is the size you're leaving.
So you know exactly how much opening you've left that way. There's no guessing at all.
Right.
In future programs, the Medical Explorer will examine some of the locally available weight control centers in Marysville and Yuba City. Besides being extremely busy with his activities as a general and vascular surgeon, Dr. Vincent Hamilton was also recently honored by his colleagues when he was elected president of the Yuba-Sutter-Colusa County Medical Society. Let's meet again with Dr. Hamilton and my other guest tonight, Mr. Ed Ebey, Executive Secretary of the Medical Society. Welcome to the Medical Explorer. Thank you.
Thank you. Nice to be here.
Thank you. Dr. Hamilton, let's begin by telling our viewers exactly what the Medical Society is and what purpose it serves in our community.
Well, the Yuba-Sutter-Colusa Medical Society is, as it says, made up of the physicians in the 3 counties. It's a branch of the California Medical Association, the local branch, and it allows doctors to formally join together for mutual interest, discussions of topics of mutual interest, dissemination of information that affect doctors, and also to allow a way that the community can make available some of the public services that the society handles.
Which we'll get into as well tonight. Are all doctors in our community, Marysville, Yuba City, members?
No, everyone is eligible. We have, I believe it's 81 doctors out of 130 that are in the society.
So there are 130 doctors in Marysville, Yuba City, and Colusa? That's interesting. I had never heard that statistic before. Mr. Ebey, how do our residents take advantage of the services of the society?
By calling the society number 673-6894.
673-6894.
Right.
And you'll be the one that would answer that
yes.
phone and answer questions regarding physicians and services, I would assume. Is that right?
That's correct.
Great. Will the medical society get involved in disciplinary actions in a health professional if he's not performing services that meet current standards?
Yes, that's obviously a difficult issue to handle and take care of. And generally speaking, there has to be a complaint lodged in order for the problem to really come to light, whether that's in a malpractice suit or a complaint to the society by one of the patients about the doctor.
Always confuses me when they would want to have an attorney involved in this, or the Board of Medical Quality Assurance, or the Medical Society, and I guess there aren't any hard rules. It just depends on which organization they might complain to, I suppose.
Well, obviously, we'd rather have them complain to the society and see what we can do.
I think we try to work out a problem early on, rather than let it get out of hand.
Right.
Have there been any disciplinary actions taken against physicians? And I, of course, am not asking about specific cases, but what kinds of things could be done?
Well, when a physician is involved in a malpractice suit, oftentimes NorCal, the major medical insurance cover, asks the insurance committee or peer review committee of the medical society to review the case, review the chart, review the records, and see whether or not there's anything that should be done in the light of if their rate should be changed, for instance. Was there really, do we medically think that there really was a mistake made, or what have you?
We often read in the paper that certain medical specialists are getting accused of things all the time. It just seems to be the nature of their work. They're in more risky things going on, and so if someone thinks something happens, you see that they're being accused all the time. So in that case, I guess the malpractice insurance company might want to raise their rates if that was happening too much.
Well, the doctors that are in the higher risk categories have a higher premium to start with.
They do already?
Yeah.
So if they wanted to change them again from that higher thing to start with, they would want to discuss it with the medical societies, I would assume.
Right. If they're considering a case, I think several years ago it was a doctor that had several cases at once, and that sort of thing is reviewed to see whether or not the doctor truly is someone who is riskier to insure.
Right. Mr. Ebey, patients often ask about doctors' qualifications. When you get a phone call from a prospective patient, will you give out information about doctors' qualifications over the phone?
Certainly.
So what types of things do people sometimes ask you on the telephone about doctors?
Oh, board certification.
Whether they're board certified or board eligible?
Yes.
Well, that leads us to another important issue, and people are always asking me what's meant by a board eligible and board certified, but I'm going to ask you, Dr. Hamilton, to tell us, what does that mean when someone has that term next to their name, board eligible or board certified?
Well, board eligible is what you are first. You have to have finished your training in an accredited university or hospital setting, and then usually within a specific time, within, say, a year to 5 years after you're finished your training and out in practice, you will have to take written and oral testing, sometimes including slides and what have you, so that you're board eligible up until the time you can either take the test or pass the test, and then board certified when you have passed those boards for your specialty.
Basically then, a doctor finishes his medical school, goes through an internship, which he has to do just to get a license in California, then takes his residency. That residency can be, for my field, 3 years, and for your field, what, 5 years? And after that, that makes him board eligible, after he does that residency.
Right.
And then some doctors then will take an exam making them board certified.
Right.
So that's the ultimate qualification, isn't it, really, to be board certified in a specialty?
Right.
How do you feel personally about patients looking for doctors who have these qualifications? Would you recommend they do that?
Well, I think a patient, ideally should have some sort of a family physician, someone who sees them for minor things, and when a major thing comes up, they're not only able to recognize it, but they're able to handle any subtle changes that might be present.
And then at that point, they could be referred or see a specialist that
Right.
does have those eligibility
Right.
or certification
Right.
qualifications.
And now also the family doctors also have a family practice department and a family practice boards themselves.
Well, that's true. I heard about the American Academy of Family Practice. I think they're having board certification as well.
Right. Right.
So there are many family physicians in the area who are also board certified.
That's right.
Okay. Do you have any idea about the numbers of doctors in our area who've gone through this extra training to become board eligible or board certified?
About 3/4 of them are.
3/4. So I forgot the numbers.
Well, it comes to be somewhere around 100.
So 100 out of the 130 or so doctors
Right.
have gone through this training.
Right.
Well, that makes our area quite sophisticated in terms of medical care.
Yes, I think they are.
People often consider smaller towns to be less medically sophisticated, but that's not true at all here.
No, I don't think so at all.
And pretty much with the many specialists in town and some of the newer fields of coming into this town, we really have almost everything.
Mhm.
Not quite, but almost everything going on here in Marysville and Yuba City, which is pretty nice.
Right, it's certainly much more convenient.
The most frequent request that you get on the phone, Mr. Ebey, is it a complaint or is it for information? What really happens on that telephone?
Mostly, most of the calls are for referrals.
I noticed that once in a while I'll call the number and I get a recording machine. Now, does that mean that you're out working on your house or something like that if the recording goes on?
It could be. I could be out in the backyard or
Usually he's on official business.
making a cup of coffee or something.
Or out driving Dr. Hamilton to the next meeting or something
Sure.
like that.
Right.
Well, obviously, many times I've tried to call you, it's been after 5, and I know you can't be by the telephone all the time. So that's why you must have that recording machine.
That's why, certainly.
He probably just left.
Okay.
Referrals are the most frequent. Then there's, excuse me, fee complaints. And we try to avoid calling the grievance committee, and we try to solve these problems without convening the committee, but many times we can't do that.
So someone might call you and have a complaint, and that you may then address that complaint to the doctor and try to work it out in some mutually convenient way rather than going to other things.
That's correct.
Right. Now, this society has actually been going on for quite a long time. I remember you were showing me, Mr. Ebey, some books from the 1800s. Is that true? Has it been going on that long?
It was established in June of 1885.
1885.
Right.
Wonder how many doctors there were in Marysville and Yuba City back in 1885.
It's pretty easy to check because the minutes have I have the minutes from these meetings.
You can actually read what doctors were complaining about back then.
Yes.
Well, that might make an interesting program in itself.
I think it would.
Let's think about that for the future. I'm curious, your background is not in medicine. What is your career background?
Well, primarily service, and then I spent 20 years as a teacher and school administrator.
Was that in this area?
Yes, it was.
How did you get involved with the Medical Society?
The man that had the job before I came on board was John White, and he was a friend of mine. And he said that he decided that he wanted to retire completely and not do anything, and then he asked me if I liked the job.
And so how long have you been doing it now?
4 years. It'll be 4 years in October.
Great. Well, things have worked out very well. Everyone speaks very highly of the work of the Medical Society.
Thank you.
And I'm looking forward to working with them as well. I have to tell everyone that I'm a member of the Medical Society, too. Dues are high, but we try to stick as members. Services are good, too. Unfortunately, our time's running out. I think before we finish, we should definitely repeat the phone number of the Medical Society. What is that, Mr. Ebey, the telephone number of the Society again?
673-6894.
Let me again thank Dr. Hamilton and Mr. Ebey for taking time out of their schedules and for joining us on the Medical Explorer tonight. Thank you very much.
Yes.